And
Hey everybody, thank you for joining us for our fifth and final learning series regarding Benco's drug and alcohol policy. Today we're going to focus on reasonable cause testing, and we're going to go back and forth on each of these slides. I'm Misty Sorte, Director of People, and this is...
I'm Sarah Frazzini, Benco's Executive Director. All right, so we're going to begin by kind of focusing on some of the verbiage from our policy, from our drug and alcohol policy. So Benco tests for drugs, alcohol, controlled substances, or prescription medication, which is taken without the supervisor or director's knowledge, that is not prescribed to the employee, when there is reasonable suspicion of use as determined by Benco management or administrative employees. So we kind of wanted to just dive into that a little bit deeper. And so reasonable suspicion is when department supervisor or administrative employee, Benco employee is observing signs, symptoms, has reason to believe that an employee is engaged in the use of drugs or alcohol. So if a department supervisor or fellow employee has reason to believe that another employee is under the influence of drugs, alcohol, controlled substances, that employee does need to report that reasonable suspicion to their supervisor. And then if an employee is working a shift and observes signs or symptoms of impairment and has reasonable suspicion to believe that their coworker may be under the influence of drugs, alcohol, the employee must immediately call their supervisor to report those observations and concerns. If the supervisor cannot be reached, then the employee would call Misty, Benco's Director of People. And if Misty can't be reached, then the employee would call Suzanne Sondermeyer, Benco's Personnel Director. And both Misty's phone number and Suzanne's phone number are on the Benco phone list at the very top under the Administrative Employees section. So either the supervisor or a director will then respond to the program immediately to observe and assess the situation and determine what those next steps are going to be. In addition, employees may be subject to testing without notice whenever there is reasonable suspicion. And when there exists reasonable suspicion that employee is impaired or affected on the job by drugs, alcohol, controlled substances, or prescription medication, which has not been disclosed to Benco. Reasonable suspicion will exist whenever any of the following behaviors are observed: the smell of alcohol or marijuana on the breath, skin, or clothing, an impaired gait, slurred, slow, or abnormal speech, disruptive behavior, sleeping on the job when it's not a proper time to sleep, frequent and unexplained absences from work, erratic work performance, difficulty with concentration, disorientation, fatigue, being lethargic, and any other behavior or appearance which is consistent with drug or alcohol use or any other controlled substance use.
So what does reasonable suspicion look like? We are not asking anyone to be an expert on drug use or the signs and symptoms. We're going to provide you with additional guidance on some of those to look out for, but really what we're looking for is somebody who is acting out of their norm, someone who appears to be impaired to a degree that they are no longer able to safely do their job. For example, if someone is generally very mellow and they're hyperactive and jumpy, that's a little bit outside the norm. So we're going to ask you to rely on your best judgment. And again, you're not going to make this decision on your own. If you feel like you have reasonable suspicion, then please call your supervisor and or me, and we will help guide you throughout the process.
kind of expanding upon signs of impairment, just like Misty said, we are not asking you to be an expert. However, providing you with additional information on what signs and symptoms might be observed when somebody is under the influence or drugs and alcohol or alcohol is extremely important. So here, is kind of a common general list of different signs of impairment: red, watery eyes, disheveled clothing, sweating profusely, droopy eyelids, lack of eye focus, flushed red face, nausea, vomiting, or excessive sweating, needle marks on the lower arm or leg, red, watery eyes or pupils that are larger or smaller than what's typical for that person. Smell of substance on the breath, body or clothes, tremors or shaking of the hands, feet or head, clumsiness, and slurred speech. Of course, with the different drug categories and drugs versus alcohol versus controlled substances, there are going to be some telltale signs, symptoms associated with each of those categories. If that's something that you're, particularly interested in asking more questions about, we can certainly answer questions as they come up. Feel free to reach out to our HR department if you want additional information regarding signs, symptoms of impairment.
What's the difference between reasonable suspicion and random drug testing? I'm going to give a brief overview, but again, on our learning session number 4, we did cover random drug testing in depth, and definitely that is posted on our YouTube. So that is something that you can access to have a little bit more guidance. If a person meets any of the criteria that was mentioned by Sarah a moment ago, or on the other previous slides, it falls into a category of reasonable suspicion. If an employee is suspected of impairment during work, a member of the HR team will accompany the person directly to Samaritan Occupational Therapy Lab to be tested. The person will be suspended until the results come back from Samaritan Labs, and that information will be confidential. If you are selected to be tested through the random testing method, you will receive a call from either Suzanne, the personnel director, or myself, letting you know that you've been randomly selected for testing at Samaritan Occupational Medicine. Be prepared to produce a urine sample at that time. Bring your driver's license, and you'll be notified you'll be notified afterwards what your test results were.
Yeah, and just to add on to that a bit, with reasonable suspicion drug testing, there have been observed signs, symptoms that cause us to believe that there's an impaired judgment and inability to complete job tasks, as Benco has outlined, and kind of within the realm of your responsibility of your role in your job. And in addition, that and not being in alignment with our policy are the reasons that an employee would then be suspended for that period of time while we're waiting for the reasonable suspicion drug test to come back. With random drug testing, we're not observing any signs or symptoms. We are, the employee is showing up to work and able to function within the requirements of the job. And so, that is part of the difference between reasonable suspicion and random testing, and the next steps that Benco takes, how it aligns with each of those. So what do you do if you think that somebody who you work with is under the influence at work? Number one priority really is making sure that people who are in our services, those who we provide supports to, are safe and being well taken care of. And so first, you want to make sure that you know what's going on with the people in our services, that they're actively engaged in, desirable tasks, whether it's watching TV, eating dinner, kind of going through that normal, typical routine. That's your first priority. And then as soon as possible, once you have been able to identify a safe place and a safe time, you must report your concerns to your direct supervisor. And so that means that if your direct supervisor is not working at the program, it's after hours, then the expectation is that you call them on their phone. If you're unable to reach your direct supervisor, then again, you would go to the next step, which would be contacting Misty, Benco's Director of People. If Misty is unavailable, then you would then contact Suzanne, Benco's personnel director. And again, all of those phone numbers are easily accessible to you on the phone list at the program.
So a big question that we've had is, am I required to report suspicions even if I'm not sure? And the answer is yes, because we know that you cannot safely perform your job as a direct service provider or direct support provider if you are under the influence. So we really do consider this under the same umbrella as the mandatory reporter training. And because we know that if you are impaired to do your job, then that could result in an unsafe situation for those that we support. So yes, the answer is you do have to report.
Another question that has come up is, if I report, will it be kept confidential? How might you be involved then in the situation? And the answer is that Benco really values confidentiality. We make every effort to keep information private and confidential, which is why in the earlier slide I said, make sure that it's the right time and the right place to contact your supervisor. We want to respect your privacy, and we also want to respect confidentiality of the person, who you have suspicions about. So if you're reporting a concern about a coworker to your supervisor will report the information that they receive to the Benco HR team. But your supervisor is not going to share information with anybody else. They're not going to share with the coworker who it was who reported them. They're not going to share with other people within the team that there are these suspicions, or that there was a specific employee who reported these suspicions. It's extremely important that we hold that information with confidence. No one within Benco will share information with the employee in question regarding anything that's disclosed. So please know that we really respect that.
Reasonable suspicion is not about trying to get people in trouble. It is about making everyone safer here at Benco. There are a lot of feelings involved when you're having to report someone of suspected wrongdoing, when there's someone that you care about, when we tend to form friendships and relationships with our coworkers. And I understand that there's a lot of personal feelings attached. But what we know at Benco is that we honor integrity. Integrity is choosing what's right over what's comfortable. And we must do what's right for those that we support. Our job is to protect those in our care above everything else. And when we hold people accountable, we're also showing our coworkers and staff that we care. If someone's coming to work impaired, then they have a problem and they need help.
We're here to support you. We're here to support all of our employees, as well as those who, are receiving care. Benco really prides itself as an organization on the professionalism, integrity, and high level of care that we provide to those who we support and our staff. Maintaining that stable workforce that feels very well supported by Benco, feels seen, feels valued, is really crucial to our overarching mission. And having employees who we know are following our policies is also part of that overarching mission. We can't risk the safety of the people who are in our care, and really need to ensure that people are showing up to work in a way, that is not impacted by any drug, alcohol, controlled substance that's not being prescribed to them. So please, if you do have questions, we're here to answer those questions as you navigate through Benco's drug and alcohol policy and what that means for you, and what that means for the kind of team that you work within. There's no wrong door. We hope that you're able to feel very comfortable going to your direct supervisor, and that your direct supervisor is able to kind of go to those at the administrative office for guidance and support. And also making sure that you know that you can always reach out to the residential director, director of people, personnel director, myself, the executive director, if you have any questions, concerns, or needs. Okay. And that is it for our presentation today.
Thank you all so much.